Hello, welcome to Clinical Education with John Williamson. My background is nursing, and I'm also a trainer. So my training has been in the UK, United Kingdom, although the principles that I'm about to introduce you to are applicable internationally. Now, my focus is on people in the UK, in Commonwealth countries, and I'm particularly interested in French-speaking African countries. So I just want to introduce you to basic life support, first aid, and one of the things I want to go through before I make this introduction is common myths that we have about helping somebody who is maybe we see them as unresponsive or we see them as lifeless. Okay, I'm going to use these two categories. So let's talk about unresponsive. Imagine walking into a room where somebody you know, might be a relative, has been unwell. Perhaps they develop a fever and you've been checking on them, and then one moment you walk into their room and you're not getting, or they don't seem to be breathing and they seem to have been without life. You're not trained in terms of knowing whether they are conscious. All you know is that they don't appear to be breathing. And even if they are breathing, they are not aware of their surroundings, they are unconscious. What do you do? So that is one category which we often describe. Growing up in Ghana, we would have described it from a layman's perspective as somebody who is without life, lifeless. So those days we were trained in resuscitation methods, so we just would say that we don't know what to do. The other person is not responsive. So they are like in a comatose coma, like sleep. So you know they are breathing, but they are not responsive. You know that they are having something and they are critically ill. So what do you do? Well, a lot of people, and I don't mean this to discredit people who have faith, but a lot of people would say, coming from maybe West African background, who have a deep faith, would say, well, I will pray for this person. Good. Faith, prayer works. But today I want to show you basic life skills which you can apply in a situation, even if you are praying, but there are certain things that you can do. So, the first thing you need to take into consideration when you approach anybody who is either injured, responsive, or in a critical condition, the first thing you need to do is to look at the immediate environment, to assess the immediate environment for danger. Now, in first aid teaching, we say start with the D, and D stands, the letter D. D stands for danger. And what are we looking for? We're looking around the immediate environment. Look around the floor. Look for any trip hazards, anything that is likely to become a stumbling obstacle. And then look up. Look at anything that might be falling, dropping on you, or the casualty, or anybody who comes later on to assist you. Look around you as well on the side. Do you have any live cables, any sharp objects in your way? Just make sure the environment is safe. That's D. Now the next thing you need to do is to look at your casualty for a response. So in general terms, if I want a response from somebody, I'm going to speak to them. So find out if they have verbal response. Now, if you're not getting a verbal response, if you know them, you call their name. John, are you okay? John, are you all right? John, speak to me. John, are you awake? Something. There isn't a perfect command, a perfect verbal command, but just get the attention, speak to them confidently, verbally. Another way, if you're not getting a verbal response, or if you're getting maybe muffled speech or something that shows you that they are not in a state where they are able to give you some feedback or describe what they're going through, well, you probably realize when you go to anybody who is asleep that even when people are asleep and they are not awake, when you touch them, they respond to touch stimuli, you know. So our senses are designed to be responsive senses. They are to be recipient senses, so we can receive information, but they also respond to information. So external stimuli. So you touch this person, very gently tap on the shoulder. By this time you know if they are on the floor or if they are on the bed, you just go close to them and you bend over and touch them. Now, if you do not get a response by a tap on the shoulder, you can look at other ways of responding. Stroke their earlobes, however you get a response, but don't inflict pain on them. Don't injure them in an attempt. Don't panic, don't become hysterical, because that will just worsen the situation in the sense that you wouldn't be able to you won't be coherent in the first place. You won't be able to coordinate what you are doing. And because it's past 7 minutes, I'm going to continue next with airway. What do we do when we are not getting a response? Now, before I end this clip, I just want to say that one of the first things you need to do if you find somebody in danger, is somebody injured, is to shout for help. In addition to the danger response, you shout for the help. So you've eliminated the danger in the environment, you've checked for a response. Alongside that, you ask for assistance. You call out for assistance. And when you call out for assistance, ensure that they come back to you. Well, we'll continue in the next clip. See you soon.